I am very concerned, not only for myself, but my colleagues, about the amount of radiation that we're all receiving during spine surgery.
I'm very concerned about repeated exposure to radiation. Over a lifetime of work, I think it's a significant problem. And it's a problem that's becoming an increasing problem, because with minimally invasive techniques, we are using far more radiation than our predecessors were.
We are very concerned about repeated irradiation, especially now that new techniques as minimally invasive surgery were introduced in spinal surgery.
The radiation exposure, it's a very important point for me because with the development of percutaneous fixation and mini-invasive techniques, you increase the dose of radiation.
I think repeated X-ray exposure, it's a major problem, not only for the surgeon but for the whole team.
Repeat radiation exposure is a very high concern in our practice, specifically in the spine field, because we do a lot of surgery repeatedly and we use fluoroscopy all the time. So the rate of radiation exposure become very important because we repeat this exposure time after time.
Decreasing the overall radiation exposure, both shielded and unshielded, is very important, because even when we're shielded, parts of us are still exposed. And this rings true for me very personally, because one of my practice partners quite recently, in the last 3-4 years, passed away from what we believe was a radiation-induced thyroid malignancy. So these are not just abstractions of fear. These are real things that we can measure, and knowing that radiation is a quantitative, accumulative dose, anything we can do to cut down even 10-20% would have a tremendous impact on our safety in practice.
I'm very concerned about the repeated radiation exposure for the simple fact that the radiation exposure is increasing day by day as we're doing more and more procedures that we rely on X-ray guidance. The number of MIS procedures are increasing. The time we use the radiation is increasing. I certainly feel that this is a time bomb waiting to go off.